Welcome to Stay Alive with Church Alive, and we present to you Ask Dr. Tommy O, and I'm proud to be the co-host of the Ask Dr. Tommy O show, and Dr. Tommy O is right here with us. But before Dr. Tommy O comes, we would like to invite you to go to our new Dr. Tommy O website. And for all of you who will go to the website, we have a special gift for you, a volume of the Journal of Negro History for the first 100 people that will go to the website. I know you're anxious, but you're going to have to wait until after this program, and you'll get all of the information. And Dr. Tommy O is going to tell you about the many different opportunities, advantages, and options that are on the website. But before we go any further, we're going to move right into our topic. And our topic is sickle cell disease. Now I would like to give you some facts on sickle cell disease. First, 1 in 12 African Americans in this country has sickle cell trait. Then, 1 in 500 African Americans has sickle cell disease. Sickle cell disease also affects people from Arabia and many from those countries in the Mediterranean. The nationalities from the Mediterranean area have sickle cell trait and sickle cell disease. So what I'm saying is that this is a serious problem. And I know back in the 60s, when I was in high school going into college, there was so much activity as to who has sickle cell. And this was something that brought fear to the people in Harlem where I grew up. But the problem of fear is lack of knowledge. And the problem of fear today about sickle cell disease is also lack of knowledge. And to bring you understanding and knowledge, we're going to present to you right now Dr. Tommy O.
Welcome.
Dr. Tommy O, what is sickle cell disease?
Well, sickle cell disease is an inherited disease that it is transferred from parents to the child or the offspring, which affects the red blood cells.
Right. Now, there's some area of the bone that it also affects. Am I correct?
Yes. Well, the bone, the marrow itself, that is the center that generates cells within the red blood cell line or the white blood cell line. Mm-hmm. So, in essence, the red blood cells are being produced by the bone marrow. The bone marrow is producing abnormal red blood cells.
Okay. Now, what is a red blood cell? Could you just mention it? But I think it's good for us to have a good understanding about it.
Exactly. Well, the red blood cell first is located in the blood. A red blood cell is a highly specialized cell, and its function is to transfer oxygen throughout the entire body.
Mm-hmm. Now, when we're talking about cells, then we have to go and also describe sickle cell.
Right.
Okay? And sickle cell disease, how would you tell it from a red blood cell?
Okay, well, let's just go over and define what a normal red blood cell looks like, and then we'll compare it to what an abnormal sickle cell disease red blood cell would look like. A normal red blood cell would be disc-shaped. It's round. It has it's biconcave, meaning that it has on both sides. It has a little. It's scalloped out a little bit. So it's scooped. It also is smooth. It's very flexible. It's able to travel throughout the body with very little resistance.
Right. Now sickle cell.
Now sickle cell. Sickle cell, the red blood cells are abnormal. They are not flexible. They're usually rigid, and they're also sickle in shape.
Mm-hmm. Like a crescent moon.
That's correct. Mm-hmm. Sickle shaped, or like the crescent when we look at the moon. Mm-hmm. It also, due to the abnormal shape, it is less flexible, and it also, the flow, it doesn't flow as smooth throughout the body because the sickle shape has a tendency to catch on the small arteries in the body, and then we have problems, which is when we have a crisis, you develop the pain.
Right. But how does one acquire a sickle cell disease?
Well, again, sickle cell is a disease that is transferred from both parents to child.
Mm-hmm. All right, just look at a chart that we have here that was going to explain sickle cell disease, and and maybe you ought to go ahead. There's something called autosomal.
Right. Let's see if we can get this up a little bit better. Right. let's just define,
Autosomal.
yeah, we'll define what sickle cell disease is. Sickle cell disease is an autosomal recessive disease. And what is autosomal? Recessive. Autosomal is one, and somal is disease. So is genes. So it's the disease that has genes from oneself, meaning the gene that comes from the parent. Since it's recessive means that it requires two genes that comes from both parents in order for the disease to be, in order to have the disease itself. Okay. Now let's go into the genes itself.
What's the normal?
Okay. Well, let's go into hemoglobin. Okay, because
right.
hemoglobin is the primary molecule within the red blood cell that transports the oxygen, and this is the area that gets affected when we're discussing sickle cell disease. So we have hemoglobin, and we're going to represent hemoglobin with capital H, little g, B.
And once again, what is hemoglobin?
Hemoglobin is a molecule that's located in the red blood cell, and its function is to carry the oxygen. Because it's a complicated molecule. We're not going to get into that because we're getting into biogenetics and so forth.
We know that we need oxygen in the body.
That's right.
So anything that carries the oxygen has got to be good.
Right.
Okay,
so its function is to carry the oxygen.
Right.
Okay. Now let's get into what this represents right here. We have what's called a dominant gene, and in this case we're going to use a capital S, and this capital S will represent sickle cell. And then we have what's called a recessive gene. Recessive gene is going to represent a small s, and that small s represent a sickle cell. All right, so you can follow the program. Okay, let's go into a normal red blood cell. A normal red blood cell will have a normal hemoglobin, which is represented here, which will be capital HGB dash capital S, capital S, and that capital S will be dominant again, and that is a normal red blood cell. For those individuals who have sickle cell disease, they will have the hemoglobin,
correct,
which is capital HGB, and then they will have two smaller genes, which are recessive genes, and that means that we have a recessive gene from both parents, the mother and the father, and that is what's called sickle cell disease. Then we have a disease what's called sickle cell trait. This is not sickle cell disease, it's a carrier state. It is called a trait. Again, we have sickle cell trait, we have hemoglobin, capital HGB, and then we have a dominant S, which is gene, and then we have a small recessive gene. Therefore, this is the trait stage or disease, not the sickle cell disease. So we have one gene which is dominant from the parent, which from one parent, which is normal, and then we have a recessive gene which is abnormal from the other parent, which would make this sickle cell trait and not sickle cell disease.
Now, if the husband is marrying or the wife is marrying someone, either one, should they be concerned that their mate has sickle cell? Should they be concerned that it could be passed on to them, husband and wife?
Well, there's always a concern, but an individual cannot transfer sickle cell disease or sickle cell trait from husband to wife or wife to husband.
In other words, it's not like AIDS.
No.
Okay.
This is a disease that is inherited, that is